If I think of the most common problems that walk through my doors, I mean, one of the things that people complain about is the static rhytides and, the crow's feet around the eyes and the brows, which people don't want. There's a massive amount of solar damage, also in the area with all the pigmentation, enlarged pores, laxity, and elastic loss in the skin as well, collagen loss. The other patients that we often get through our doors is as well as men coming in with vascularity, with these enlarged veins across their faces that makes them look like they're heavy drinkers, and it's actually just solar damage. And it's quite incredible to see how they improve as well and how good they feel about it. Other patients that we also see is people with sepcase, and as you know, I mean, that's sometimes, not necessarily solar damage. It's a genetic problem as well, and we've got one or two women there where we have done a massive clean-up with laser work, as an example, on the seborrheic keratosis, and the result has just been absolutely incredible, and they're also very happy with it because nobody likes those senile warts all over their bodies. So that's probably the most common problems that I think that walks in through our doors. Where I work, there's a lot of farmers and miners in the area, and needless to say, people have got extensive solar damage, lots of squamous cell cancers, basal cell cancers, melanoma, the usual sort of array. But because of the harsh climate there, people's skins are very dehydrated and they've got lots of actinic keratosis as well. I call them barnacles because, it's almost like they're shipwrecked. And so there's a lot of, management protocols as well. And we also go quite a lot into diet as well and preventative measures. And I try and tell people that it's not just women who get solar damage, men as well, and they're also the ones who die from the cancers, and preventative measures. And it's amazing how they eventually also come on board trying to improve the quality of their skins and getting more involved in preventative measures. I think, when I started out in cosmetic medicine and introducing it, it was very, very hard for me because there was nobody around, and we didn't have courses like this available. And you had to literally go and visit clinics to try and find out. And there was not a lot of people who were willing to actually impart information to you. So you had to try and find your way around the equipment. And of course, you end up making mistakes like that as well. And buy stuff that you shouldn't have, or as an example, I acquired a laser machine and did not realize that in Queensland there was all these rules and regulations around it. And I just think that the courses that we're offering here at the moment, even though it's not specifics that we're actually going into, they get a very, very good overview of what is available, and we're trying to teach them so that they've got more information to ask questions and make a better informed decision.